Have you ever checked your blood pressure and felt surprised by the number? Maybe you felt completely fine, no headache, no dizziness, yet the reading was high. And then you were told, keep an eye on it, but no one really explained why it happens or what you can actually do about it. Here's something many people don't realize. High blood pressure often builds quietly, without clear warning signs. And by the time you notice it, it's already been affecting your body. But here's the question most people never ask. Is it really possible to bring it down naturally, without relying only on medication? We'll come back to that. Let me give you something useful right away. One of the fastest ways to influence your blood pressure is not a pill. It's your daily routine, especially how you move, how you breathe, and what you eat consistently. Small shifts can change your numbers more than you expect. I'm Dr. Robert Miller, and I spend a lot of my time reviewing medical research and translating it into simple, practical steps so you can understand your body and take control of your health. If you find this kind of clear, no confusion guidance helpful, consider subscribing. My goal is to make health easier to understand, especially as your body changes with age. In this video, we're going to look at what actually works. Not trends, not internet myths, but real, research-backed habits that can help your blood pressure settle in a natural and steady way. And there's one overlooked pattern that many people completely miss that may be quietly raising their numbers. So what exactly is high blood pressure? Let's make this very simple. It means the force of your blood pushing against your blood vessel walls is higher than it should be, not just once, but consistently over time. Think of your blood vessels like flexible pipes. When you're younger, those pipes are soft, elastic. They expand easily when blood flows through, almost like a new garden hose that adjusts smoothly when water pressure increases. But as you age, those vessels slowly become stiffer, less flexible. Not overnight, but gradually, year by year. Now imagine pushing water through a tight pipe. The pressure inside rises, because the pipe can't expand the way it used to. That's essentially what's happening in your body. This might sound familiar. Have you ever noticed your blood pressure creeping up, even though your lifestyle hasn't changed much? That's often because your blood vessels have changed, even if your habits stayed the same. And this is where it becomes important. Blood pressure isn't just about your heart. Many people think, if my heart is okay, I'm fine. But your heart is only one part of the system. It's about your entire system. Your blood vessels, your kidneys, your nervous system, all working together, quietly, in the background. Let me give you a simple way to picture this. Your heart is like a pump. Your blood vessels are the pipes. Your kidneys help control fluid levels, and your nervous system controls how tight or relaxed those pipes are. Now imagine, if the pipes are slightly stiff, the fluid is a bit higher, and the system is a little tense. Even small changes can increase pressure. Have you ever had a day where you felt slightly stressed or didn't sleep well, and your body just felt off? That same internal tension can influence your blood pressure too. And this is the part most people miss. With age, this system becomes more sensitive. It reacts more easily. So things that didn't affect you before, like a salty meal, a poor night's sleep, or a day without movement, can now have a noticeable impact. Even small imbalances can push your numbers higher, not because something is suddenly wrong, but because your body has less flexibility to adjust. And this is why understanding the system matters. Because once you see how everything is connected, you can start making small changes that support the whole system, not just one part. Let me give you a simple example. A 68-year-old man once told me, "My blood pressure is always fine in the morning, but higher in the evening." At first, he thought it was just random. Maybe the machine was off, or maybe it didn't really matter. But when we looked closer, a pattern started to appear. His mornings were calm. He moved a little, had a light breakfast, felt relatively relaxed. But his evenings were very different. Long periods of sitting, snacking without thinking, and watching the news, which, as you know, can quietly increase stress. This might sound familiar. Have you ever noticed how your body feels different in the evening? A bit heavier, a bit more tense, maybe less energetic? And this is where it becomes important. His body wasn't getting a chance to reset. No movement to help circulation. No real relaxation to calm the system. So that pressure slowly built up over the day. Think of it like this. Imagine a room slowly filling with warm air. If you never open a window, the temperature keeps rising. Your body works in a similar way. Without breaks, without movement, without relaxation, pressure can quietly increase. Here's something many people don't know. Blood pressure isn't a fixed number. It's not the same all day. It naturally rises and falls, depending on what you're doing, what you're eating, and how your body is responding. Let me ask you something. When do you usually check your blood pressure? Is it always at the same time? Because this is the part most people miss. Timing matters. A single reading doesn't tell the full story. And one overlooked pattern is this: evening elevation. For many people over 60, blood pressure tends to rise later in the day. Not suddenly, but gradually. Why does this happen? Because the day adds up. Small stresses, less movement, more sitting, and often more salt in evening meals. All of these together create a kind of build-up effect in the body. This is where it becomes even more important. Your nervous system becomes slightly more activated, your blood vessels a bit tighter, and your body holds on to more fluid. All of that raises pressure. Let me share something brief. Another patient, in her early 70s, only checked her blood pressure every morning. It always looked fine, but she often felt uneasy in the evening. When she finally checked at night, her numbers were consistently higher. That changed how we approached her routine, not with drastic steps, but with small adjustments in the evening. And this highlights a key point. If you only check your blood pressure in the morning, you might miss what your body is experiencing later in the day. And that matters, because those evening patterns can quietly influence your long-term health, even if your morning numbers look normal. So what can you actually do? Let's start simple, because this doesn't have to be complicated, and it doesn't require extreme effort. First, gentle movement. You don't need intense exercise. In fact, pushing too hard can sometimes put extra strain on your system, especially if your body isn't used to it. What your body responds best to is regular, low-impact movement, the kind that feels natural, not forced. Walking, light stretching, even 10 to 15 minutes after meals. Let me explain why this matters in a very practical way. When you move, even a little, your blood vessels begin to open up. They relax. Blood flows more smoothly. Think of it like slowly unkinking a hose. Water starts flowing more freely, with less pressure. That's what gentle movement does inside your body. This might sound familiar. Have you ever taken a short walk after sitting for a long time and felt lighter afterward? Less stiff? More comfortable? That's your circulation improving in real time. And this is where it becomes important. Movement is not just about fitness, it's about signaling. You're sending a message to your body. Relax, adjust, rebalance. Even 10 minutes, done consistently, can start to shift your baseline over time. Let me ask you something. Do you sit for long periods during the day? Maybe watching TV, using your phone, or just resting for hours at a time? If yes, your blood vessels may be staying in a more tightened state, almost like they're on standby, but never fully relaxing. And this is the part most people miss. It's not just lack of exercise, it's lack of interruption. Long, continuous sitting, without breaks, can slowly increase pressure in your system. Now here's the second piece, and this is where most people get confused. Salt. You've probably heard, reduce salt. And yes, that matters. But that's only half the picture. It's not just about removing salt. It's about balance. Let me explain this simply. Sodium, which comes from salt, can cause your body to hold on to fluid. More fluid means more pressure inside your vessels. But your body has a natural counterbalance, potassium. Potassium helps your blood vessels relax. It also helps your body release excess sodium. So instead of just cutting something out, you're restoring balance. This might surprise you. Many older adults reduce salt, but don't increase potassium. So the balance is still off. Let me give you a quick example. A man in his early 70s stopped adding salt to his meals, but his diet was mostly processed foods, low in potassium. His blood pressure didn't improve much. Once he started adding simple foods, like a banana in the morning or spinach with meals, his numbers slowly became more stable. This is where it becomes even more important. It's not about strict restriction. It's about supporting your body's natural system. Foods like bananas, spinach, sweet potatoes help your body do what it's already trying to do: reduce pressure, gently and naturally. And the key here is consistency, not perfection. Small daily choices, repeated over time, can create a noticeable difference. There was a woman in her early 70s who avoided salt completely. She was very careful. She read labels. She avoided adding salt. She believed she was doing everything right, but her blood pressure was still high. That confused her. And honestly, it frustrates a lot of people. When we looked deeper, her diet lacked potassium-rich foods. So even though she reduced sodium, her body didn't have the balance it needed. Think of it like this. It's not just about lowering one side. It's about supporting the other. Like trying to balance a scale. If you only remove weight from one side, but don't support the other, the balance is still off. Once she added potassium-rich foods consistently, simple things, nothing extreme, her numbers began to improve. Not overnight, but steadily. And this is important to understand. Your body doesn't usually change in one day, but it responds very well to consistent signals. This might sound familiar. Have you ever made a healthy change and felt like nothing is happening at first? But then after a few weeks, things start to shift. That's exactly how this works. This is where it becomes even more important. Your nervous system plays a major role, and this is something many people don't realize. Your body is always in one of two general states, relaxed or alert. Stress, even low-level stress, keeps your body in a slightly tense state. Not enough to notice clearly, but enough to affect your system. Your blood vessels tighten slightly, your heart works a bit harder, and over time, that keeps pressure elevated. And this is the part most people miss. It's not just big stress, it's the constant small stress. News, noise, worrying thoughts, mental tension that never fully switches off. Let me ask you something. Do you ever feel on edge, even when nothing serious is happening? That quiet tension matters more than you think. So what helps here? Simple breathing. And I mean very simple. Slow, controlled breathing. Inhale gently, hold briefly, then exhale longer than you inhale. This signals your body to relax, almost like pressing a reset button. Think of your nervous system like a dimmer switch. Breathing slowly turns the intensity down. And this is where it becomes important. When your nervous system relaxes, your blood vessels follow. They widen. Pressure inside them decreases. Even 5 minutes a day can make a measurable difference. Not dramatic in one moment, but meaningful over time. Some people notice it right away, a sense of calm, slightly lower readings, especially if done regularly. Now let's talk about something subtle, sleep. Many people overlook this, because sleep feels passive, like nothing is happening. But in reality, sleep is when your body resets everything. Your heart rate, your blood pressure, your nervous system. Poor sleep, or waking up frequently at night, can raise blood pressure the next day. Why? Because your body didn't fully reset. It stayed partially active, almost like a machine that was never fully turned off. Let me give you a simple picture. Imagine charging your phone overnight, but the charger keeps disconnecting. In the morning, the battery is not fully restored. That's what disrupted sleep does to your body. Let me ask you something. Do you wake up feeling truly rested, clear, calm, recharged, or just okay and a bit tired? That difference matters more than you think, because feeling okay often means your body is still carrying tension from the night before. And over time, that can quietly influence your blood pressure, day after day. Research from institutions like the American Heart Association shows that lifestyle changes can significantly reduce blood pressure over time, sometimes by 5 to 10 points or more. And that may sound small, but in medicine, that difference can lower your risk of heart disease and stroke in a meaningful way. This might sound surprising. Have you ever thought a few small changes couldn't really matter? But when those changes happen every day, your body starts responding, quietly but consistently. Now let's break down what's actually happening inside your body. Because once you understand this, everything starts to make more sense. First mechanism, tight blood vessels. When your vessels stay slightly constricted, pressure increases. Think of it like squeezing a hose. The tighter it gets, the higher the pressure inside. Movement and potassium help relax them. They allow those vessels to open up again. That's why they work. Not by force, but by restoring flexibility. Second mechanism, fluid balance. Too much sodium and not enough potassium causes your body to retain fluid. Let me explain this simply. More fluid inside your system means more volume pushing through your vessels, and that raises pressure. This is where it becomes important. It's not just what you remove, it's what you restore. Balance is the key. Third mechanism, nervous system activation. Chronic stress keeps your system in alert mode. Even if you don't feel stressed, your body might still be holding that tension. Your heart beats a little faster, your vessels stay slightly tighter, and over time, that keeps pressure elevated. Breathing and sleep help calm this. They tell your body, it's safe to relax now. This is the part many people miss. It's not one single cause, not just salt, not just stress, not just lack of movement. It's a combination of small daily patterns, stacked together, repeated every day. Let me ask you something. If just one habit can raise your pressure slightly, what do you think happens when several small habits combine? So what does a simple daily plan look like? Nothing complicated. And that's important, because complicated plans don't last. Morning, a short walk, even 10 minutes. This helps your body wake up properly and sets a calmer baseline for the day. Meals, add potassium-rich foods, reduce processed foods. This might sound familiar. Many packaged foods contain hidden sodium, even when they don't taste salty. Afternoon or evening, light movement again. Avoid long sitting periods. This is where most people slip. The day slows down, and movement stops completely, but even a few minutes can reset your system. Before bed, slow breathing for a few minutes. Limit stimulation. Think of this as preparing your body for recovery, not just sleep, but real restoration. This isn't about perfection. It's about consistency, doing small things again and again. Now let's talk about timeline, because this is where expectations matter. You may not see changes in a day, and that's normal, but within a few weeks, you may notice more stable readings, less fluctuation. After a few months, the effect becomes more consistent, more predictable. Long-term, these habits support your entire cardiovascular system, not just blood pressure, your heart, your vessels, your circulation. This is where it becomes even more important. You're not just lowering a number, you're supporting how your body functions as a whole. Why does this often get missed? Because most checkups are just snapshots, one reading, one moment. But your body changes throughout the day, and lifestyle patterns don't always show up immediately. This might sound familiar. You go for a checkup, everything looks okay, but you still don't feel quite right. That's because patterns take time to appear, and they often happen outside the clinic. Let me say this clearly. If your doctor has prescribed medication, do not stop it on your own. These natural approaches are meant to support your treatment, not replace it suddenly. And this is important. Combining both often gives the best results. And if your readings are very high, or you feel symptoms like chest pain, dizziness, or shortness of breath, seek medical care promptly. But here's the encouraging part. If you're dealing with high blood pressure, you're not alone. It's extremely common after 60, and it's often manageable with the right approach. Small daily actions can lead to meaningful changes, not instantly, but steadily. And steady change is what truly lasts. So let me ask you, have you noticed your blood pressure changing at different times of the day? Morning versus evening? That pattern alone can tell you a lot about what your body needs. If you're comfortable, share your experience in the comments. It may help someone else understand their own body better. And if you found this helpful, consider subscribing for more simple, practical health guidance. Take care of your body. It responds more than you think.